Hello and welcome to New Horizons in Health, bringing veterans healthcare into the future. I'm Dr. Sharif El-Nahal, proud to serve as Undersecretary for Health at the Department of Veterans Affairs, serving more than 9 million enrolled veterans across the United States. This podcast is about the cutting-edge research, programming, and work that we are doing for veterans, particularly providing them world-class care with the latest and best technology and new innovation. And today we're going to be talking about tele-emergency care, which is now available to any veteran across the United States and U.S. territories. No matter where you live, you now can have access to tele-emergency care if you need it, right in the comfort of your own home. And today I have incredible panelists who will help us talk about what this new type of therapy can do for veterans and how we're going to expand even more offerings into the future. I'm really excited to hear, especially from our veteran today, Krista Seals, about her experience with our VA Health Connect platform, as well as Rebecca Wilt, our tele-emergency care nurse manager who serves veterans in her region. So they're joining me here in the room today. Also joining the discussion is Dr. Neil Patel, Acting Executive Director of VA's National Emergency Medicine Office, as well as Josh Geiger, a veteran employee of that office who's been instrumental in establishing tele-emergency care at the VA. And so without further ado, we'll get started with Krista. So please tell us a little bit about yourself and your service.
Well, first of all, thanks so much for having me today. I appreciate it. A little bit about my service. I joined straight out of high school. I was in the Army for about 8 years. I was a military intelligence analyst, served in South Korea for about a year, working WMD, and then went to JBLM in Washington State, worked with the Criminal Investigation Division for about 6 more years, and medically retired in 2020.
Terrific. Really appreciate your service to the country. And just tell us a little bit about what brought you to VA for your healthcare.
Well, most of it was because I was medically retired. I had been, in the Army medical system for a long time, and I actually got a lot of benefit out of it and where all the programs were going. So I thought, why not continue with the VA? The healthcare seemed really good, and it was free at that point. So, why not continue? It's been really great since then.
Yeah. No, really, it's just an incredible honor to run a system that has often the best quality that we can offer to veterans, but also presented to them at little to no cost, which is really, a function of, frankly, the care that you've earned in serving the country. So really appreciate that. Neil, before we hear a little bit more about Krista's experience with tele-emergency care, can you just tell us what VA Health Connect is, how it works, and then how veterans can be referred to tele-emergency care using VA Health Connect?
Absolutely. So again, thank you for having me on. VA Health Connect is incredible, right? So it's VA's attempt to make this really easy for veterans. If you have a need to schedule an appointment, refill a medication, talk to a pharmacist, if any kind of health concern that you have that's not an emergency, your first line is really to call VA Health Connect. And from then on, the folks at VA Health Connect can direct the veteran to where they need to go, including if they have an acute symptom, we can get their symptom triaged, and that triage professional can determine if tele-emergency care is right for that patient. And if they are, then they transfer you right over to a tele-emergency care nurse or tele-emergency care doc, and we can get on a video visit with you and see if we can take care of your issue right then.
That's great. So how does a veteran know when it's appropriate to call VA Health Connect for a question they have at their healthcare versus just saying, wow, I'm just going to call 911 because I'm concerned and I don't know if this is an emergency? Can you tell us about that dynamic?
Yeah, such a great question. Actually, really easy. So, things that we learned in grade school, what we should call 911 for, those are things we should call 911 for. If you think you're having a heart attack, your stroke, you don't know, call 911, no problem. But if you think you're not ready to pass out right then, or you have another concern, just call us VA Health Connect. So again, just 2 numbers, right? You got to know 911 and what we all learned, when to call 911, and for everything else, there's VA Health Connect, and we can get you to the right place for care.
Terrific. Really appreciate it. So Rebecca, let's move to you. Veterans call through VA Health Connect to a tele-emergency care line, and they get awesome professionals like you on the other end. So tell us how that works from your perspective and what kind of services you offer to veterans.
Sure. So when you call VA Health Connect, the first person you talk to is a telephone triage nurse. And they are broadly trained professionals that do a lot of different parsing out for the veteran. So they might be calling to confirm what time their appointment is that day, or they might be calling because their arm suddenly feels weak and they're not sure what to do. And they might connect them with 911, or they might be calling with a symptom that falls into a wider range, and then that veteran is eligible to come to us. So our target group of patients is people who need care within about 0 to 2 hours, maybe need that contact with a medical professional, or they recommend that the patient goes by 911, but for whatever reason, the veterans decline. They go ahead, they come to us. We have a nurse that receives the call. They provide a focused assessment. They review the meds, allergies, contact needs, that sort of thing. And then they go and they see a physician. And our physicians see them either by phone or by video. So whatever modality the veteran has available to them, we work with. And we're happy to walk them through the setting up the video call if that's appropriate for them. And the physician will see them, they'll provide their recommendations, and then the nurse helps with the care coordination afterwards. So it might be getting a veteran linked up with their medications. Maybe we call back the next evening to see if the overnight prescriptions arrived. We set them up with primary care appointments, specialty care appointments, all sorts of things so that we can close the loop at the end of that visit within 1 or 2 phone calls, either that initial phone call or we call back and do some follow-up.
Good. Yeah. So entire point, I think, is to get veterans connected to the next best step in their care. And often that can be resolved right on the line with a veteran. But, when your judgment kicks in and says, wow, this might be an emergency, then we let the veteran know and make sure they connect them. So just
Absolutely.
Yeah,
Yep.
just really appreciate that very much. Krista, tell us about your specific experience with VA Health Connect and teleemergency care. How was that care for you? Did you find it helpful? And really any other thing you want to tell us about VA healthcare?
Yeah, so the VA Health Connect I've used a few different times. The emergency care was the first time that I've heard of that, and it was incredibly beneficial. I didn't know it was a thing. I actually just called the nurse's hotline because I had a very persistent cough that not only didn't go away, but it felt like it was getting a little worse. And I started having like a metallic taste in my throat. I'm like, maybe I should call the nurse's hotline. So I did, and she recommended that I go to the urgent care or emergency room, which being 4 months pregnant and having a toddler at home and in the middle of my workday, I'm like, I'm exhausted. I don't want to go wait in an 8-hour waiting room. And I asked her, is there any other option that I can do? And she said, hold on, let me make a phone call. And in less than an hour, I got connected with a doctor and got it taken care of. So, I mean, it was a huge benefit to not only me as a veteran, that has my old life, but to me as a mother, to me as, someone who still works. And yeah, it was very beneficial.
Love to hear it. Yeah, we're trying to be more and more present in veterans' lives where they are to make it more convenient for folks like you to be able to access your earned health care. And it's just a really, really helpful to know that, and gratifying, frankly, that our team was there for you. Yeah. So let's move to Josh. TeleEC at VA was really your brainchild, I'm told. And we often have some of the best and most innovative staff members. I know you're a veteran yourself. And so can you tell us what sparked this idea as a veteran employee, as an emergency professional, and as someone who's wanted to give back to veterans like yourself?
Yeah, thanks for having me, sir. So I can't take that much credit for it. It was, I did come up with a good idea, but it took a lot of people to get where it is today. A lot of creative people at the beginning that sort of bought into the idea and championed it through. We're willing to try this new sort of way of care, right? But it goes back to what Neil and Vivica said, as far as I knew enough, right? What I learned in grade school, that I didn't always have to go to the emergency department for the things that I had issues with that were service connected. And I also know, working in emergency medicine, that they're broadly trained professionals. So I was like, I think we could do this by phone, which sounded a little crazy, emergency care by phone, right? but it was born out of a similar experience that Krista had. I was getting care at the VA, right? Busy life, 3 kids at home, traveling for work, and I was like, I feel like there's something that we can do a little bit differently. So to be able to kind of come up with this idea and for it to kind of move forward as a care modality was awesome. To be able to just pick up the phone and call, and that's really what I was looking for. And so, but to hear stories like Krista's, and to hear about how it's given back to veterans and made it so convenient, that's really, in all honesty, the honor of my life, right? I feel like I've contributed to something that does some good for veterans, and it makes me feel like I've done enough to give back, right, for their care. So I'm ecstatic that it's at the point that it's at.
Yeah, you really should be, Josh. And it's why I always say that we are strengthened and we're made better by not only having talented professionals in every position we can in the VA, but also folks who understand what it's like to be a veteran, veterans themselves on our teams. Because you really sparked an idea that ended up becoming now a nationwide offering to veterans that can help them when they're most vulnerable. So really, really appreciate that. Rebecca, back to you as, again, the nurse manager for your region's tele-EC program. You've got a workforce of talented folks who are seeing veterans, dialing in when they're concerned about a potential emergency. Is there a specific story that stands out to you when you or your team helped a veteran that you want to tell us about?
I think what really stands out to me about the program itself is what Krista and Josh just touched on. That kind of solidified a lot of concepts I hear from the VA for me, which is we talk about the whole health model of care, and you really see it in action in all the different paths that bring the veteran to us. So a veteran leaves the service and they start this new life, and it continues, right, through their entire lifespan, and their needs change over time. What they're balancing changes over time. So they might be parents, then they might become caregivers, and they can't easily leave home. They have their professional career, but maybe it's economically not feasible for them to miss a day of work. There's a lot that our veterans are carrying and balancing, and this opening up another door of access helps us lighten their load. And I think some of the cases that have stood out to me the most are sometimes where we get a call from the veteran's caregiver, and I know that we really focus in the VA in that caregiver support role, but I didn't always see that from our emergency room side, but I see it a lot in tele-EC, where they call us, and sometimes the veterans that they're caring for are really ill, but it is a lot for them to maybe get the veteran in the car, call 911, and they're not sure if that's the right thing. So they come through to us, and sometimes talking with the physician to make the best choice for them and talk through those whole health considerations, and for the veteran to have, and the caregiver to have dedicated time with a doctor where they're one-on-one and there's no distractions, right? You have an ER, you have bells ringing and intercoms and things crashing in the hallway. And it's a really difficult environment to have an intimate conversation, and bringing it to telephone or video allows them to connect. And sometimes we've provided life-saving care by saying, no, I as a physician in the ER would really want to see you here, and this is why you need to go. And that helps the caregiver know that they're doing the right thing, and it helps the veteran know that they're doing the right thing. And sometimes we've had really good catches and good outcomes where I worry that if the veteran stayed at home, it would have been a bad outcome. But getting to have that one-on-one conversation, they got to get to the right place. So yes, sometimes we get to help a veteran stay home, and that's fantastic. And sometimes it's having the time to see what their needs are, discuss them holistically, and get them to the right place so they can get sometimes life-saving care.
Yeah, it's really terrific. It's a touch point that at the very least can, get a veteran what they need. If it's simple, calm them down, make them aware of other options for care that they might have. And it can also be life-saving, as you said, get to an ER as soon as possible because we're really concerned. And so point is, it's yet another way we can be there for veterans over and above what we have been doing. So really appreciate that. Neil, let's go back to you as an emergency physician yourself. What do you see as one of the main potential benefits to veterans and the VA employees who serve them with this technology? Where do you see the big picture going with this?
Yeah, so great question. So, when we work in our emergency departments, we recognize that patients wait 6, 7, 8 hours. And we're talking general emergency departments for care, and that's simply because they're not the sickest person, there. But the emergency department is often the most convenient place for care, and that's why people come. And so, why not? With teleemergency care, we've now created an even more convenient place for care. And so as physicians, we love it because we can help veterans take care of their issue right where they are without having them necessarily come to the ED and then crowd up the waiting room. And our waiting rooms, ED waiting rooms are not a great place to be, right? Especially in flu season. If you came in with something, you're walking out with a respiratory illness probably if you waited in that waiting room. And so for us, this teleemergency care is ironically a weird way of using technology to bring back the old school doc with a black bag come into your home to take care of you. Now we're using video technology to make that happen again. And like Rebecca said, we also don't like the noise, bells, whistles, kind of all that distraction from us actually getting to see you one to one. And so being able to restore that old timey medicine and really kind of have a human connection back again using technology, amazing, just amazing as a provider.
Yeah, I couldn't agree more. Can you tell us about the percentage of veterans from the national data, Neil, who have their concerns essentially resolved right on the tele-EC call and ultimately avoiding having to go to the emergency room? Do you have a sense of that breakdown?
Yeah, and actually, this is what's most surprised us about teleemergency care is that when we have that nurse triage system, right, we don't want to miss an emergency, and so we oftentimes will tell veterans, hey, look, this may or may not be an emergency, but we can't tell over the telephone over a quick conversation. So you got to go to the ED or go to urgent care. And actually, when we pair that person with a virtual encounter with the emergency care professional, we can resolve over half. So currently, the national number is around 60% of all veterans who call and get connected to teleemergency care can actually have their acute issue resolved simply virtually. And it's not conversation. We can do things like prescribe medications. We can order labs and imaging at the veterans local VA clinic, so it's convenient for them, and they can get their X-ray or their imaging test or their lab test at a time that's convenient for them.
Yeah, it's great. And I appreciate that you offered some examples there because we can actually do things to help you medically through the tele-EC line and virtually. And so really, really helpful data there, Neil. Josh, let's go to you. How do veterans actually access VA Health Connect? Give us the nuts and bolts. Veterans listening or watching this, how can they actually access teleemergency care?
Yeah, easy question. They call their medical center, option 3. That's VA Health Connect. So most veterans know the phone number to their VA hospital. They just call that, and it'll be option 3 when they call in, and they'll get right to VA Health Connect, and they'll get connected to a nurse, and then proceed on with whatever their needs are.
That's great. Easy enough. Really appreciate it, Josh. And thank you again. You really set up an awesome program. Krista, of course, we will close with you. What would you like VA to know to better care for veterans like you? So what should we know? And then what would you tell other veterans about VA Health Connect, teleemergency care, and just VA care more generally?
Yeah, definitely. I think first and foremost, I think the message to veterans is don't sleep on VA care. I think there's such a stigma behind the VA from, the previous decades, but there's so much evolution going on thanks to the creative leadership and new programs that it's really something we should take advantage of. And it's really helped people like myself and many others that have gone to the VA and taken advantage of these programs for the healthcare. And I mean, I've seen how much it would cost in the civilian world, and it's just something that veterans should not have to pay out of pocket for. And so this resource is here. We need to use it, and veterans like me, I mean, I really appreciate the openness and creativity and the ability to grow and evolve the healthcare system like you guys have been doing. So that's my biggest message to veterans and to the VA as well.
Well, terrific. So they heard it, folks, straight from a veteran herself on, the quality of VA services, but also the fact that, you guys earn this care. This is care that you earned by serving the country, serving folks like me who've benefited from the freedom that you've been defending. And so really just appreciate being able to offer this. I want to thank my panel, especially Krista, our veteran, but everybody on the VA team who contributed today. We are trying to make our services as fast and accessible and efficient for you as possible. Again, that's what you've earned, it's what you deserve. And this is one of many ways we're trying to do that. Tele-emergency care gets an expert professional who knows what they're doing on emergency care on the line with you within minutes. And that's something that we're able to offer anywhere in the country now. We want you to know about these services. Call your medical center, press 3, as Josh was just mentioning, and you'll get right connected to VA Health Connect. And then if you need it, tele-emergency care. So thank you all again. This has been New Horizons in Health, bringing veteran healthcare into the future. Thank you all so much for listening and watching. Take care.